Thank you for tuning in because this show sucks. We need to protect our healthcare systems, and healthcare management is not responsible and accountable for mismanaging the healthcare systems. They want to blame the unvaccinated.
I think that we have to protect our hospitals.
So again, we need to protect that healthcare system.
The people who chose not to get vaccinated are now the ones clogging up our ICU systems and our hospital beds. That
We've been hearing for months from our unelected healthcare officials that we need to protect our healthcare systems.
We need to protect our healthcare system.
And they've been telling us two things. One, get vaccinated. And number two, stay at home and isolate alone in a bubble. We've been told for about a year, if we get vaccinated, we will have some of our freedoms returned to us as privileges. Or was it just simply a lie? Even before the rise of Omicron, we saw these promises eroded away at a substantial rate. Venues that required proof of vaccination, the capacities were reduced, while dancing was still illegal. We even saw a call from these unelected health officials to ban COVID immunization-free people from all gatherings and encouraging domestic segregation within families and close friends, further dividing our nation.
If you are planning on hosting holiday events, it is advisable to ensure everyone in attendance is fully vaccinated. Even with vaccination, it appears with Omicron that you can still transmit it with 2 doses vaccinated.
Just like Dr. Moore admits right there, regardless of your vaccination status, you can still get infected with COVID Omicron, whether you're vaccinated or not. This is further backed up on the Canadian government website, where we can quote it saying, a percentage of people who are vaccinated against COVID-19 will still get sick, and some may be hospitalized or die. If you're telling somebody to isolate at home in a bubble alone, what is the purpose of them getting the vaccine? The vaccine was supposed to be for them to go out and enjoy life, not to sit at home, isolated in a bubble, by themselves, alone. We're being conditioned by the government and the mainstream media to be ashamed to ask questions about the vaccine passport and the vaccine mandates. And the plan for early treatment of COVID. A majority of the population has been vaccinated and they don't care about someone else's vaccine status. What they care about is the treatment that they can get if they catch COVID. Their interest is they want to know what kind of medication and early treatment is available for when you do get infected with COVID. These health officials and the government just simply tells us the same thing over and over and over. We need to protect our healthcare system. This is a weird concept to grasp, to put the onus on the public to protect the system. I thought we had healthcare officials and management teams to protect our healthcare systems. And guess what? We do. Each province has its own healthcare authority to manage their own healthcare systems. Why isn't anyone in the legacy media talking about this? Every once in a while, though, we do have Anthony Furey from the Toronto Sun pop up with a question, and just recently asked one of Ontario's top doctors why we are not holding the unelected, overpaid healthcare officials and management accountable for mismanaging the healthcare system. Let's take a look.
ICU, a massive amount of the provincial budget goes into the healthcare system, and there are a lot of people paid a lot of money to manage this system. But why do you think it is that they have failed to properly manage for this presumably preventable moment where the burden is now once again expected to fall on regular people?
I think that's an unfair statement about some very, very hard work by people within our system over the last while. If you take a look at what they've done in terms of moving patients around the province to try to manage load, if you look at how hard doctors and nurses have worked, I don't think that the assertion that they've mismanaged and failed the people of Ontario is fair or true.
This so-called top doctor either did not understand the question or he purposely deflected the attention and the meaning of the question. The first thing we noticed is how offended he is by the question simply because it calls his position and management skills into question along with the other unelected, overpaid healthcare officials. He deflected the attention from the management level to regular doctors and nurses and makes it look like he is offended for them. He is talking about just during the COVID-19 pandemic and completely ignored the years of neglect on the Canadian healthcare system before. The fact he is unable to admit any sort of fault for mismanagement at the management level shows they don't actually care about your health. The question wasn't about the doctors and nurses working on the front line at all. The question was about the health officials and the people that run the show that get paid hundreds of thousands of dollars per year to do their jobs that they're currently not doing. The system has been failing for 20 years. In fact, Canada's failing healthcare system is not a secret. It's been reported on multiple times by the Toronto Sun, the Heritage, Global News, and even the CBC. Also, with the use of publicly available data that anyone can access that has an internet connection from statista.com, we could see the density of hospital beds in Canada from 1976 to 2019, before the pandemic. In this first image, we're looking at from 1976 to 1995. In 1976, we had 6.92 beds per 1,000 population. And then in 1995, it was 4.7. This next image we're looking at shows from 1995 to 2015. As you already know, 1995, there was 4.7 beds. As of 2015, 2.62 beds. And in this last image, we will see from 2003 to 2019, but we will focus on 2015 to 2019. In 2015, 2.62 beds per 1,000 population. In 2019, 2.52 beds per population. Now what needs to happen is we need to hold everyone accountable for the mismanagement of the healthcare system. This has failed on many levels. This did not happen because of the pandemic. This has been going on for 2 decades. That is 20 years of failing healthcare system in Canada. This is our universal healthcare system. It needs to be looked at, and we need to find out what's going on. There may need to be a change in the way that the health officials are appointed. Instead of being appointed, maybe they are elected and they don't have as much pay, so there's an incentive to keep the job. So we can be confident that they're working for the public and not for a special interest group. You can even think about the hospital beds as supply and demand. Just like when there's a mass immigration and the population grows, the bed counts go down per 1,000 population, lowering the bed capacity per capita. With mass immigration and Justin Trudeau's future planned mass immigration of 400,000 new immigrants coming to Canada, we inject a mass amount of population into Canadian cities, therefore putting more stress on the currently fragile healthcare system we already have. With Justin Trudeau's planned mass immigration of 400,000 new immigrants to Canada, where is he going to plan to get the money to increase the healthcare capacity for our nation? The only thing we can think of here is with his current spending habits is he's going to just start printing more money to cover the costs, and in turn that's going to raise the taxes for the taxpayers. Alright everyone, that's all we have for you today. Don't forget to like this video, subscribe to the channel, push that notifications button to get more.